Good morning, people. Welcome back to Joy Connections. One of the most difficult questions that I've had to repeatedly have to answer since I was diagnosed with cancer is, when is the treatment? Why are they not treating this? It's been said in different ways, but basically it's surrounding treatment. And that question has been difficult for me to answer to people because it's also a question that I have been answering, I have been asking. Initially, asking the doctors and the nurses, and then after a few weeks, I was just asking the question in my head. Don't know, maybe I was asking God. And I think I am going to answer that question the best way I can. With me, the reason why I was asking that question was when they first diagnosed me with cancer, I just immediately felt like this needs to be handled before it spirals. And so my first question was, can it be treated? And then they said, yes, we believe we can treat it. We can either remove the tumor or kill the tumor. And so, even though some people don't see it as treatment, what I've been going through up until last week is part of the protocols of treatment, because what they have to do is weigh the treatment options available, and they weigh them against your capacity to withstand the treatment approach they choose. So they check how strong you are, how fit you are. And unfortunately for me, because I have several other health issues, some of the treatment options had to be disqualified without even trying them, because I wouldn't be strong enough for them. I have a heart problem, which disqualified the original plan to have surgery, because apparently the surgery involves deflating my lung, and it would be some hours of that surgery being done. It would take some hours, and because of this heart problem that I have, I can't pronounce the name of it. My heart would not be strong enough to hold up for the 5 hours that they were talking about. So surgery was excluded from the plan. And for them to come to that exclusion of the plan, I had to take initial steps first to see if my fitness could be changed. So I went on a program they call a pre-hab program, where I was placed on a certain diet, where I have to do certain activities each day on my own, and I have to go into the gym with a fitness instructor who specializes in the area of fitness to do with surgery. Oh my God, that has been very difficult. When my next session is next Tuesday, and I'm gonna take a little video of the room, the equipment that I have been using since March to try and get my fitness to the level that would suffice for me to have surgery. But while I was doing that, that's when the reviews and the other tests that they were doing, the CT scans, the MRI scans and the echo, yeah, it's called an echo, that they did is what then revealed that my heart is not strong enough for the surgery. And then, so the next best, according to them, option is radiotherapy. And also going into the radiotherapy regime, there were also some checks that they needed to do so that I can be fit enough to withstand radiotherapy. And also so they can decide how they are going to space it out. Apparently, the dose for radiotherapy is the same, but depending on your fitness, it can be administered in the dose spread out. So you can either have 3 spaced out, or you can have 5 spaced out, or you can have 7 spaced out, and I think it goes up to 13. And so what has initially been decided is I'll have 5. Then they will review and see if that has worked. If it hasn't, I'll have another whatever, 3 or 5, up to 13, I think. And that would be spread out through months. I'm not yet sure how far it's going to be spread out at, because at the moment it's still trying to see how I'm responding to it. It's kind of a maze, guys. And doing the exercises when you're dosed up with medication, including those for the other health conditions, it's a maze. And people get afraid because they base their fear on what they have observed happening with or to other people who have gone through a cancer treatment. But I would advise people not to compare yourself. Do not compare yourself, because you can put a whole lot of pressure on yourself unnecessarily. You can instill a whole lot of fear in yourself unnecessarily. And you can even at times end up feeling discouraged or discouraging yourself unnecessarily. So with me, it's a bit complex because I have other things going on health-wise. This came up while I was on treatment for other things, other complex health issues as well. And so that is what is making it very difficult and very tricky and unpredictable. And also the other reason why you should not compare yourself is cancer is discovered at different stages. How well or how unwell this treatment would go also depends on the stage your cancer is at, and how hard it will be also depends on that. The stage of the cancer, your age, your health status before the cancer, and a whole lot of other things. So please do not compare yourself. And when I'm sharing this, don't use my journey to discourage you. You don't have the health issues that I have. Maybe you do, but maybe they're at different levels. They're affecting you at different levels. So remember that if you're going through that, if you're going through cancer treatment right now. I'm just sharing to build awareness, because it's a topic that seems to be taboo to many people, and I think it shouldn't be, because it leaves us ignorant when we don't talk about these things. Please continue to watch my videos. Please share them, and please pass your comments. I'm keen to hear from you.